Now with the Juvederm, I like to start up here close to the nasal ala here. I'm inserting in here, 1, 2, 3, stick. Now this is a little bit more sensitive an area. We like to place topical numbing cream here because the closer that you get to the mouth, the more nerve endings that you have. And placing a numbing cream on for the first few minutes prior can just kind of help with that. Although these needles are very small, and as you can see, it's a fairly painless procedure. Coming into the oral commissures here. You can see how that really helps to add that nice transition. Moving down to the marionette lines with my remaining product. This will also help to soften her jowls. And this is another area that I'll be massaging in afterwards to smooth the product. I'll place the remainder right in this pocket here. And it just helps, you can already see with these fillers how it just kind of helps to add a nice little transition here. Just like in the injection site, you want to hold pressure for a couple of minutes just to minimize the bruising. Alright, so I'm going to come over, do the same thing on the other side with another syringe of the Juvederm. I'm going to have you turn just a touch more towards me. Perfect. So again, starting right at the base of the nose here, right at that nasal ala. This tends to be the area where those nasolabial folds are the deepest. Oftentimes people will have some mild asymmetries on either side of their face depending on when you're driving, what face has more sun exposure, when you're sleeping, what side of the face that you sleep on the most. So you want to take that into account when you're doing these injectables as well. Try to correct for any of those little asymmetries that you might come across. So you can see how that really helps smooth out that transition. Now, for example, on this side, her marionette lines aren't quite as prominent as compared to the other side, so I won't need to save quite as much product for this area. Okay, and that's it as far as the fillers.